Hello, myself Mohammad Riza Ahmed and I belongs to group number 466. I am a fourth year medical student of Astana Medical University. So today my topic is about the respiratory system, the auscultations of the lungs, about the practical session, and before the examinations of the respiratory system we'll check for the oral cavity, the nose, the throat, and then we'll go for the other assessment, other examinations. Is like there is 4 subdivisions, is like that is inspection, palpation, percussions, and the auscultations. Before auscultation we'll do inspection, palpation, percussion. So in auscultation so many people are doing in that way, like a Z pattern, zigzag pattern, and so many people are doing in S pattern, etc. Today I am going to describe the main points regarding the auscultation. The precaution that we have to take before doing auscultation to the patient, that we have to maintain the hygiene and we have to wear a gloves. For the secondly, we will look for there is any kind of allergy. If there is a presence of allergy in the skin, then we will not do auscultation. And thirdly, we will look for the maintain of the temperature in our hand or in the stethoscope. And fourthly, we will remove the cloth of the patients to hear the appropriate breath sound. So these are the precautions that we have to take before auscultation. And the patient position should be in sitting positions at the time of auscultation. And when we are continuing to doing the auscultations, at that time we ask the patient to inhale and exhale breathe. So in the auscultation, the points which I am going to mentioning right now, the points is showing on my side, so you can see when I am going to describe about the point. So first of all, the point that we have to need to be very careful. The firstly we will check for the you can see in the pictures the clavicles, two clavicles. Between the two clavicles there is a notch point. So in the notch point we can hear the sound of trachea. So after that, the second point is that upper the clavicles, you can see the one points, and these points indicates the upper loop in both sides of the lungs. And thirdly, you can see the below the first intercostal ribs there is a one point, and this point indicates the upper loop of the lungs. And the breathing sounds in this point is vesicular breathing, and we can hear in normal patient. And thirdly, you can see in below the third intercostal space there is a one point, and this point indicated the upper loops in both sides of the lungs. But we have to be careful in the fourth intercostal space. In the left lungs, the upper lobe and the lower lobe, there are 2 lobes, but in the right lungs there are 3 lobes: superior, middle, and the inferior lobe. So in the left lung, the upper lobe is bigger than the lower lobe. So the fourth intercostal space indicate in the left side, this one is a upper lobe, and the fourth intercostal space indicate in the right side, this one is a middle lobe. And in the 6 intercostal ribs we can see the point which is the lower lobe in both lungs. So now I am going to describe the posterior sides. In the posterior side, we have to be careful at the time of auscultations that we will not use a stethoscope in the scapular regions, because we have to avoid the bony area, because we cannot hear the breathing sound too appropriately in that area. So the first points here we can see in the upper the suprascapular regions, we can see which is shown in the pictures. In that area we can see the upper lobe of the lungs. The anatomical positions of the upper lobe is C7 to T3. And the second point, we can see the behind the vertebral column there is 2 points which is shown in the pictures. So in the upper points is indicating the upper lobe, and the lower point which is indicating the lower lobe. The lower lobe anatomical position is that T3 to T10. So the below the third point is that below the infrascapular regions there is a 1 point, and it indicating the points of lower lobe of the lungs.